Monitoring your residents is one of your most important tasks as a care provider. There are many things that can cause changes in your clients. These include medication side effects, the effects of new medications, disease states, and other outside factors such as stress or psychological crisis. What's important to remember is that as you're caring for your clients, you want to watch for any changes and report them to the appropriate medical professional. As we go through this information, remember it is not your role as a caregiver to diagnose disease, but rather it is your job to monitor for changes and report them to the appropriate medical professional. Monitoring begins by getting to know the person you're caring for. The better you know the individual and know what's normal for him or her, the better you'll be able to spot changes. So here are a few ways you can get to know the person you're caring for. First is through any pre-admission assessments. While state requirements will vary, facilities in every state are required to obtain some form of pre-admission information. This can include physicians' reports, reports from family members, as well as direct assessments done by medical professionals within your community. You'll also want to obtain a detailed client history, reported by the individual themselves or by their family or responsible party. It's important to know their daily routines and habits. When do they usually get out of bed? How long do they usually sleep? Eating patterns, even voiding patterns can be important things to know in order to monitor for changes. It's also helpful to be familiar with the individual's personality. Many changes, both physical and psychological, will manifest themselves as changes in personality. Someone may become more irritable, more depressed, have difficulty remembering things, etc. Remember, establishing a baseline of what's normal for each individual you care for will make it easier for you to spot changes in the future. So get to know your residents as best as you possibly can. As a caregiver, you're not going to perform a formal head-to-toe physical assessment, but rather most of your observations will occur throughout the day as you're caring for and interacting with the individual. But to make it easier for you to remember some of the important signs and symptoms you should be watching for, we're going to start at the head and work our way all the way down to the toes, discussing major areas and organ systems in the body and some of the signs and symptoms you should be watching for. Starting up top at the person's head, one of the most important things you want to watch for are any changes in level of consciousness. If the person appears groggy or more seriously loses consciousness, this can be a sign of a serious emergency. You also want to watch for cognitive changes. These could include memory loss, difficulty speaking, confusion, and paranoia or other psychotic symptoms. Also watch for drooping eyelids or slurring of speech, as these could be possible signs of a stroke. Experienced professional caregivers will check the mouth to get an idea of the overall quality of care. Pay special attention to the teeth and gums, looking for cleanliness, any redness or irritation, bleeding, open sores in the mouth, and also foul breath or halitosis. Additionally, if the person uses dentures, look at the dentures for cleanliness, that they're in good quality condition, and that they fit properly. Next is the heart and lungs. Some of the most serious and life-threatening conditions can present themselves here, so watch closely. Things you can look for and should respond to immediately include shortness of breath, a racing heart rate, an abnormal heart rate or a pulse that is out of rhythm, fluttering or tightness reported in the person's chest, and also frequent coughing. While frequent coughing is not likely a sign of a heart condition, it can indicate infections in the lungs, pneumonia, etc. Anytime you suspect a possible cardiac abnormality, it must be reported immediately. And if you're ever in doubt, of course, call 911 right away. You can also spot changes in the arms and the hands. Weakness, particularly on one side of the body, for example, can be a sign of a stroke. Radiating pain down the arm or shoulder can be a symptom during a heart attack. Moving down the body, keep an eye on the person's abdominal area. Do they report any stomach pains or cramping, loss of appetite, or heartburn? You should also monitor the person's stool patterns and the condition of their stool. Is it excessively loose or soft? Is it more hard than normal? Has it become black or tarry, which can be a sign of blood in the stool? All of these things should be reported to the person's physician. Next, we want to keep an eye on the person's urinary output. Now, I know that doesn't sound like very much fun, but it's an important step for a caregiver to take. Watch to see if the person you're caring for is urinating more or less frequently. Watch to see if they are urinating more or smaller amounts of urine as well. You can also inspect the condition of the urine. Is it darker than usual? Does it appear white or cloudy, which can be pus in the urine from an infection? Are there any blood or red streaks in the urine? Also a sign of infection. Additionally, unexplained back or flank pain can be a sign of serious kidney problems. In the legs, you want to watch for any pain, tingling, burning, or numbness. All of these can be signs of serious nerve or circulatory problems that are especially problematic in diabetics. Also watch the legs, especially further down around the ankles and the feet, for swollen or puffy appearance, something known as edema. When edema becomes serious, this can be a sign of heart problems, because when the heart's not working efficiently, fluid builds up down in the legs and causes this edema or puffiness. Don't forget to monitor the person's skin. This is one of the easiest parts of the body to observe, and in the frail or the elderly, one of the most at risk. Here's a few things to watch for: irritation, dryness, redness, hives, cuts or skin tears, bruises, or any rashes. You also want to watch for any changes in skin integrity or pressure ulcers, also known as bed sores. These can begin as small reddened areas, and as they get worse, can become large open wounds that even go all the way down to the underlying bone or muscle. There are some general things you should keep in mind when we talk about monitoring your clients for changes. First of all, as we said, you've already gotten to know the individual, so you need to follow your instincts. If something seems like it's just not right, if you can't quite put your finger on it, but you know something is different about the person, you need to report it. Even if you have a hard time accurately describing the signs or symptoms, you need to report to your supervisor and/or the appropriate medical professional that you feel something has changed. A good example is in nonverbal individuals or persons that have trouble speaking. Because they cannot tell you that something is wrong, they often display problems through changes in personality or behavior. They may become more irritable, they may become cranky or grouchy, they may lash out at caregivers. And again, in that instance, you don't necessarily know what is wrong with them, but you know something is not right. And reporting it can be the first step in correcting the underlying problem. Also remember that a sign or symptom in one part of the body can actually be a clue to problems happening elsewhere. A weak hand or drooping foot could be a sign of a stroke that has happened in the person's brain. It's not enough just to identify changes. You must follow up and report them to the appropriate individual. When reporting, the caregiver must decide between 4 or more possible people to report the information to. This can include calling 911, reporting to the client's physician, contacting their family, and notifying your supervisor. So how do you decide? Well, first of all, remember to follow your facility policy and state regulations regarding reporting. Let's take a second to go through each possible resource that you might report to, starting with 911. As we've already stated, when in doubt, you should call 911. Some specific examples of when you would call 911 include any signs or symptoms of serious distress, such as loss of consciousness, difficulty breathing, chest pain, severe bleeding, etc. By calling 911, you ensure the quickest access to safe and appropriate medical care for the individual you're caring for. Next is the physician and your supervisor. Any change in condition should be reported to the physician and to your supervisor, even if you've already notified 911. It's very important that you don't forget to follow up with the physician. If you leave them a message or you send them a fax, you must make sure that you get a response. This may sometimes mean that you have to call the physician's office 2, 3, or 4 times, and you may feel like you're bothering them. But remember, the priority is the safety and security of the individual you're caring for, so follow up with that doctor. Your client's family or responsible party should also be notified of any changes in condition. But follow your facility policy regarding how this notification is made. In some facilities, this is done only by your supervisor or administrative staff. It's also important that you don't use the family as a substitute for reporting to the physician or calling 911. While the family needs to be kept apprised and aware of what's going on, they are not a substitute for good medical care. As a caregiver, there's a good chance you spend more time with your clients than anyone else in their life. This often means you're going to identify changes in condition before anyone else. Monitoring for those changes, reporting them, and following up appropriately is one of the most important things you can do for the persons you're caring for. Much success to you in monitoring for changes in condition.